podcast today, and through signs of magnesium deficiency. For the past several years, I've gotten to know about the important roles of magnesium in our metabolism, as well as many functions and many conditions uh, can be treated with daily magnesium supplement, such as tingling sensation of your fingers or your legs and hands, or a patient with migraines, or those with constipation. So a lot of condition. And the nice thing about magnesium daily supplement is that there's very, very little risk of toxicity. So you can take that daily and your body can get rid of that. If there's too much magnesium, then there's no positive effect. Now, a lot of conditions that are caused by magnesium deficiency can also be caused by many, many other conditions. So you can't presume that it's the only thing that may be explaining. But sometimes before doing extensive testing, one can try taking daily magnesium to see whether it helps. So that's an affordable way to both treat and diagnose a condition. So magnesium plays such an important role in the functions of multiple organ systems in our body, and recognizing the signs and symptoms of magnesium deficiency can lead to an easy correction of this problem. I will discuss how and when you can either supplement yourself with magnesium or ask your primary care provider to check the level for you to confirm your suspicion of having magnesium deficiency. There are certain populations, such as migraine sufferers, that take daily magnesium last year of magnesium toxicity. Persistent vitamin D deficiency. So magnesium is required in the activation of vitamin D. Despite taking daily vitamin D supplementation, this is due to the fact that vitamin D supplementation only comes in an inactive form, which needs to be converted into an active form by both the liver and kidneys. There are studies showing that patients' vitamin D level rising after adding magnesium supplementation and fail to rise prior to adding magnesium. Low vitamin D can happen for other reasons other than having low magnesium, such as having liver and kidney dysfunction or UV light exposure. But if correcting the magnesium level is the easiest way to raise vitamin D level in those who fail to increase their level even after long-standing vitamin D supplementation. Also, if taking too much vitamin D without activation into active level can worsen calcium buildup in blood vessel and other organ system. Vitamin D plays an important role in also other functions, especially accurately obtained by patients. Healthcare providers also should check to make sure patient magnesium level is not deficient. The mechanism of magnesium's lowering of blood pressure is due to mobilization of calcium out of the smooth muscles of the blood vessel, causing these vessels to contract instead of relax, and hence raise our blood pressure. Another magnesium mechanism of lowering your blood pressure is how it affects the renin-aldosterone system, which controls the fluid balance and pressure by modulating the hormonal system in our kidneys. So it has dual functions in helping lowering our blood pressure. One is regulating the mobilization of calcium out of the smooth muscles. And since calcium mobilizing into our smooth muscle cells cause contraction of those smooth muscles, magnesium has a direct role in the renin-aldosterone system, which also can help affect our blood pressure by lowering it. Number 3, magnesium help reduce the central nervous system excitatory system by blocking the NMDA receptors. These receptors are the excitatory receptors, and when they are overstimulated, it increases the amount of pain in migraines and can cause many other problems, including seizures, which sometimes we use medication to block these receptors to help patients with seizures after they fail many other treatments. Also, recent meta-analysis has shown, which is a study that includes several other studies of the same topic, has shown that both IV, intravenous, and oral magnesium can lower the frequency and intensity of migraines. So it's one of the neurologist's favorite daily regimen to prevent migraines. For their chronic migraine patients, they need to give them daily magnesium besides vitamin B, riboflavin, because they are low risk and very minimal risk, but they can have potential of reducing the frequency and severity of those terrible migraines. Number 4, insomnia. Magnesium is important in both initiating sleep as well as staying asleep. Magnesium does this by helping regulating this central nervous system GABA receptors, which is the opposite to NMDA receptors, which are excitatory. GABA is the one that calm down. So when you stimulate these receptors, it calm down the nervous system and help you fall asleep and also reduce anxiety. A lot of the medications that help us sleep or help us calm our nerves down, like the benzodiazepine, like Valium or diazepam, Xanax, and even Zolpidem or Ambien, common name, they all act on GABA receptors. GABA stimulation is affected when there is magnesium deficiency. Another anti-excitatory mechanism is by reducing the cortisol level in the brain, which is the main stress hormone, and this allows your brain to relax. Having low magnesium allows for elevated cortisol level in the evening, impairing your ability to fall asleep even when you do not feel stressed. Multiple studies have proven the adverse effects of having low magnesium in delaying sleep or onset, as well as causing frequent awakenings. Remember in previous episode when I discussed the importance of staying in the rest and digest system by working to stimulate the GABA and inhibiting the NMDA receptor effects. Magnesium is a major ingredient of the rest and digest system, which is your daily friend. It also helps activating the GABA receptors to help calm our nerves and also reduce the cortisol level in the evening, which is a stress hormone, the main stress hormones. So magnesium can be very important in helping us falling asleep also. But the main key is that it helps allow us to keep our rest and digest system activated. Number 5, heart palpitation is another adverse effect of magnesium deficiency. Magnesium does this by regulating the flow of calcium and potassium in and out of the heart muscle cells, which helps keeps your heart rate steady and coordinated. Another effect is the overstimulation of the fight or flight response that causes persistent stimulation of the heart and hence your faster heart rate and palpitations, which can be exacerbated by insomnia, another sign of magnesium deficiency, and consumption of caffeine, saying that it is important to get a full medical evaluation if you feel like you have palpitation instead of just taking magnesium supplement, since there are other causes of palpitations and you do not want to miss some dangerous arrhythmia causing palpitation such as atrial fibrillation. Untreated atrial fibrillation is the most common cause of ischemic strokes, which can have a devastating effect on anyone. Also, palpitations can be a warning sign for heart failure, so it's important to make sure that that's is not what causing the palpitations. So again, in this particular case, something that you cannot presume that it is the magnesium that is causing the problem, but it needs to be worked up and make sure that there's no other serious causes for your palpitations. Besides, before assuming that this is magnesium deficiency. Number 6, foot and hand tingling and numbness is another sign of magnesium deficiency. So magnesium is important for the function of nerve conduction by stabilizing the membranes of the nerve cells and also regulate the flowing of calcium and sodium in and out of the nerve cells. When there is not sufficient magnesium around, the nerve cell membranes become more unstable, causing firing of signal, which we feel as tingling and numbness. So magnesium level is important information to check beside B12, vitamin B12, folic acid, diabetes that are of sugar level and thyroid levels in those with numbness and tingling. And as a physician for over 20 years, I see patients affected by tingling symptoms almost on a daily basis. It's an extremely common condition and can be debilitating, especially at nighttime when you sleep. The symptom can be more severe. Number 7, muscle cramps, leg cramps, especially at night, or random twitches in your eyelids, calves, and hands can be caused by magnesium deficiency. The American Association of Neurology listed low magnesium as an important cause of muscle cramps, as well as other electrolyte deficiency. In this case, by regulating the flow of calcium in and out of muscle cells, magnesium helps stabilize skeletal muscle membrane and help control cramps. Another mechanism is that magnesium controls the flow of potassium in and out of our muscle cells, which also helps stabilize the skeletal muscle membranes. So magnesium directly affects muscle contractions as well as affecting the function of other electrolytes in helping preventing muscle cramps. Any slight disturbance in our hydration status of electrolytes can cause muscle cramps and can be very annoying and debilitating at times. And before doing any major workup, perhaps having patient hydrating well, especially during the day. Also, another thing that can help a muscle cramp is having them stretch daily. And I think that 2 to 3 weeks after she started doing that, her muscle cramp complaint reduced by about 90%. Number 8, persistent fatigue. Magnesium is responsible for the making of our energy molecules called ATP. And without enough magnesium level, you do not have enough ATP despite consuming enough calories. This causes energy crash since all your cells struggle to get enough energy to function due to magnesium deficiency, which is essential in our um, cellular energy generation by cellular structure called the mitochondria. Number 9, magnesium deficiency can also cause calcium deficiency. It can cause potassium deficiency. And let me tell you why is it important. So magnesium deficiency in a lot of patients due to medications or chronic kidney conditions or so on, they can have low potassium, and potassium have so many functions, and having deficiency can cause muscle weakness, fatigue, cramping, palpitation, and constipation. A lot of overlapping symptoms with hypomagnesia, having a low magnesium level, and severe low potassium level can lead to also life-threatening conditions such as arrhythmias, respiratory, muscle paralysis. So it's important to check magnesium level when you have patients with persistently low potassium level, especially those with symptoms caused by low potassium level, to check for magnesium level. Not unlike vitamin D, to make sure that you need to correct the magnesium level before you can raise the vitamin D or the potassium level. And you can see how correcting magnesium can improve many conditions by allowing your body to have adequate level of potassium and vitamin D by regulating the mobilization of calcium, sodium, potassium in and out of your muscle cells, even the blood vessels, heart muscle cells, skeletal muscle cells in your muscles, and so on. Another sign of magnesium deficiency. So number 1 and 2 is called persistent vitamin B and potassium deficiency, both of which can have very important function in your system and can lead to very dangerous conditions such as arrhythmia, as in low potassium, and also chronic muscle fatigue, weakness. So when you have patient with low vitamin D and potassium and can be corrected, make sure you check for magnesium level. Magnesium can also help lower the blood pressure in those patients with difficult to control blood pressure. You can consult your healthcare provider since there are other causes that can also cause persistently elevated blood pressure. Magnesium help reduce migraines by blocking the NMDA receptors. Magnesium can help with insomnia by activating the GAD-1 receptors. Magnesium can help reduce heart palpitations in patients with persistent or with new onset palpitations, but this need to be evaluated in an office setting. Magnesium can help reduce foot and hand tingling and numbness sensation, and also magnesium can reduce muscle cramps and leg cramps every night. And also magnesium can help reduce persistent fatigue. In a future episode, I will discuss what kind of magnesium supplement will give you the biggest bang for your buck, since there are so many kinds of magnesium supplements out there. Full disclosure, the more I learn about magnesium, the more I am impressed of how important it is to all aspects of our health due to its crucial role in regulating the flows of other important electrolytes such as calcium and potassium and sodium into and out of our nerves, musculoskeletal cells, as well as muscle cells, and explaining why its deficiency can lead to suffer a wide range of potentially debilitating chronic symptoms, as well as acute symptoms that can go undiagnosed for years. Another very cool thing about magnesium deficiency is that you can take magnesium without fear of causing toxicity, unlike something like potassium, in which you cannot take without that prescribed by a healthcare provider, since taking too much potassium can be also dangerous for your health. Please watch out if you have these chronic conditions and haven't been diagnosed. The non-serious condition as chronic, we can do a trial of magnesium supplement, and to be continue on the magnesium topic, since we're just about to try and and I do take magnesium glycinate every morning now with electrolyte packets that I put in, and 8 to 10 hours of water to help right after I wake up in the morning. I think that's important to supplement yourself with some electrical water since after waking up, you are in a state of dehydration already. And have a great day, everyone. And thank you for taking time to tune in to this episode.